Hi, I'm Dr. Brookman, and I'm one of the breast surgical oncologists with Ironwood Cancer and Research Centers. And I work here at the Goodyear location as well as the Surprise location. And today, I'm here to talk to you about surgery and preparing yourself for surgery. When you're, as a patient, looking to schedule your surgery, you're going to have the best outcome if you prepare yourself in advance. And so you want to be your best version of yourself for surgery so that you can lower your risk of complications and have an easier recovery. So the first thing that I recommend is learn as much as you can about your procedure and your surgery. You want to talk to the surgeon. You want to write down all of your questions, do some research in advance so that you have a list of questions when you go to visit with your doctor about the procedure. You want to talk with the anesthesiologist. A lot of times you won't be able to talk to the anesthesiologist until the day of surgery, but think about questions that you have for them in advance. And if you've had any problems with anesthesia in the past, make sure that you bring up those problems and let them know so that they can better manage you during the surgery. The other thing that you want to think about is recovery. And you want to ask about, are there any permanent lifestyle changes that you'll need to make after the surgery as part of the recovery? The other thing is a lot of hospitals will have some classes or instructional videos about how to prepare for a specific type of surgery or how to recover. So it's always good to research those resources as well. Another thing that you want to always prepare for is making sure that you're lowering your risk for infections. And so you want to maintain good personal hygiene both before surgery and after surgery. The hospital is also going to give you a special scrub soap to bathe with either the night before or sometimes also the day of surgery. So you want to make sure that you use that specific soap to lower the bacterial burden on your body before surgery. Another thing that you want to do before surgery is clarify all of your medications. So make sure that you understand all the different medications that you take, what you take them for, and then you want to clarify which medications you should be continuing through the perioperative period or up to surgery and after surgery. And then you want to clarify which medications you need to stop and when you should stop them before surgery. The next thing that you want to do when you're looking at scheduling the surgery is you want to make sure you schedule a visit with your primary care physician. And the reason why you want to do that is because you want to make sure that any other chronic medical problems that you have that they're managing can be either stabilized or optimized before you go into surgery, if possible. This is particularly important for people with vascular disease, cardiac disease, any pulmonary issues, diabetes, or if somebody has any kind of immune system compromise. The next thing that you want to do is you want to get active. So people who are active are better able to tolerate surgery and are going to have a lower risk of complications, and the recovery is going to be easier. So talk with your doctor about what you can do to get active or stay active, maintain your physical activity going into surgery. This is going to be different for all different people because people have varying levels of ability and various levels of physical stamina. So the most important thing is just to be active and stay active. This could be something as simple as just walking for 15 minutes every night and up until the day of surgery. But you want to get active, and that's going to really help with your recovery. One of the other things that you want to make sure that you're looking at as you're planning surgery is managing your weight and your diet. So you want to make sure that you're eating healthy foods, making sure that you're getting all the necessary vitamins and minerals so that your body is optimized to go through surgery and heal properly. The other thing is people that have a normal body weight or normal BMI have a lower risk of complications. So if you can, you want to move your body towards that normal BMI window before surgery. Another thing that you need to consider when you're planning surgery is you want to make sure you're limiting your alcohol use or stopping it altogether. Alcohol can really interfere with medications, specifically narcotics when you're recovering from surgery, as well as it can interfere with the effects of anesthesia. So you really want to minimize your alcohol use before surgery or stop it altogether. Now, if you're looking at scheduling surgery and you use tobacco or you're smoking, you want to make sure that you're quitting smoking, quitting nicotine, any of those products in advance before surgery. And the earlier that you quit, the lower your risk of complications. Now, smoking or Using tobacco products increases your risk of infections. It increases your risk of pneumonia, heart attack, other cardiac events with surgery. So you really can lower your risk of complications by stopping smoking or using tobacco products at all before surgery. Now, when you think about nicotine, you have nicotine has cardiovascular effects, and then you also have the carcinogenic effects of tobacco use. So when you're quitting smoking, you're getting the benefits of reducing any cardiac risks as well as reducing any future risks of developing cancer. One of the things I'm always very careful to let my patients know about if they're smoking and they're going to continue to smoke through the perioperative period is that I say, please do not smoke on the day of your surgery, because smoking just on the day of surgery increases your risk of surgical site infections by 60%. Another thing that you want to consider when you're looking to schedule surgery is you want to set yourself up for success at home. So you want to make sure that you have either friends, family, or neighbors that are going to be around and available after surgery to help you, either with things around the house or with cooking meals or other activities of daily living that you might need assistance with in that early recovery period when you can't do everything for yourself. The other thing you want to do is make sure that you have someone that is available to drive you to and from the hospital for the day of surgery. You want to make sure that you have all the necessary items for recovery at home, whether it be a specific surgical bra or something for drains or crutches or whatever type of surgery you're having. You want to make sure you have all of those things at home set up in advance. And the other thing is that you want to make sure you have plenty of healthy foods and drinks in the fridge and freezer in advance so that when you get home, you're not making extra trips to the grocery store. Now, all of these things that I've talked about, these are not just for people having breast cancer surgery. These are tips and tricks that are going to help you have an easier recovery from any type of surgery that you're facing. Thanks for watching. I wish you the best in your surgical recovery.